February is Heart Month. We just went Red for Women about a week and a half ago, and it's a great time to drive awareness of cardiovascular disease and remind people about what we can all do to reduce our risk.
Dr. Amy Kahn from Regence BlueCross BlueShield joining us this morning. Always great to have you along here with us. Thanks for joining us.
Thank you, you two. It's great to be here.
And Dr. Kahn, I'm wondering, during the pandemic, those with heart disease, how has this pandemic affected their health?
Right. Well, with the exception of excess deaths due to COVID-19 this past year, we have seen continued deaths. In fact, heart disease or cardiovascular disease remain the #1 cause of death in the U.S. And across the U.S., that means 655,000 Americans lose their lives annually. And cardiovascular disease refers to a number of conditions, and those include heart attack, heart failure, cardiac arrhythmia, coronary artery disease are a number of them that are more common. There are several chronic conditions, and your lifestyle, being of older age and certain ethnic minorities, as well as having a family history of heart problems, put you at better or greater risk for the development of heart disease. But there are many things that you can do to reduce that risk, which include, of course, regular exercise, following a good diet, stopping tobacco, and really making sure you're keeping track of those health measures like blood pressure to reduce the risk of cardiovascular disease.
What are some of the symptoms? I know it's a little bit different between genders, actually, but what are some of the overall symptoms, and then break down the differences?
Right. So first off, every 40 seconds, someone in the U.S. has a heart attack, and that really highlights the importance of recognizing those signs and symptoms and acting immediately to get help. So a heart attack or myocardial infarction, it typically occurs when there's not enough blood flow to certain parts of the heart muscle, and men and women typically experience that chest pressure, chest pain, shortness of breath, maybe discomfort in the jaw, neck, or shoulder. But many don't realize that women are more likely to experience nausea, vomiting, lightheadedness, and an unusual sense of tiredness.
And you talked a little bit about self-care, and you mentioned that women, the symptoms as far as heart disease, that it impacts more women than men. Speaking personally, it's hard for me to do self-care where a lot of women may feel a little guilty. But in this case, you're saying it's so important, it's so crucial that we take care of ourselves.
Absolutely. And it includes both men and women, right? In addition to practicing those good health habits, talk to your doctor about your family history and your risks to reduce the onset of heart disease. So it's important to get those periodic screenings, blood pressure checks, check your blood glucose or blood sugar and blood cholesterol, really keeping track of your weight. We know that medications prescribed by your doctor to treat hypertension, diabetes, cholesterol problems will further prevent the onset of heart disease and other medical complications. And managing these chronic conditions is also important, particularly with the pandemic, as they are associated with increased risks of hospitalizations due to COVID-19.
Okay, something to always be mindful of. Without heart health, you don't have health.
Mm-hmm. Keep it in check.
Dr. Amy Kahn, thanks for joining us this morning.
Thank you.
And for more on this story, or if you have health-related questions that you would like answered, send an email to healthiertogether@fox13now.com.